Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Desmond Ebanks. He is the founder of Alternity Healthcare and a leading expert in age management and performance medicine for executives and entrepreneurs. Thank you for joining us today.
Thank you for having me, John. It's a pleasure.
Yeah. And just to give our listeners a bit of backstory, how did you get here and what are you building right now?
Okay, so I'm a board certified internist, in conventional medicine. I've practiced initially emergency medicine and occupational medicine and a little bit of insurance medicine early on. Looking back on that, I see that I really have been, searching for the right place for me. And, as an internist, I felt for a long time that internal medicine doesn't do a lot to fix problems, right? It treats issues. And so I wanted to get to a place where we're focusing on actually keeping people well. And I spent a little time going to conferences to learn the things I didn't learn in medical school about wellness, about nutrition, about exercise, actually, and even about hormone therapy. And maybe it was a little arrogant at the time, because I didn't have a practice. I didn't have practice to draw from. I created my plan after visiting, several places that are involved with longevity and age management at the time. And I built out my space and, sort of like, if you build it, they will come. So that's the business side of it that, they didn't immediately come. And I had to learn how to, manage that time and learn the business aspects of things to actually get patients in so that I can do what I do best for them.
Yeah. And it sounds like you've been building that over several years. What solutions do you provide specifically now with services?
Well, uh, you still have to have the cores, right? And the core is, nutrition, what you eat, when you eat, how much you eat it. Physical activity, we provide hormone therapy. We work on, stress management and sleep for people. But over the years, the additional layers, onto that are some regenerative therapies using platelet-rich plasma, exosomes, and peptides have been a big part of my practice for about a dozen years or so. They are, there's a big buzz over peptides now, and that's good and bad because the peptides that we use really all come from a compounding pharmacy and they have to be prescribed. To me, it's a little bit alarming that there are websites where, peptides are manufactured. They tell you they're not for human consumption, which means they have not necessarily met the good manufacturing, the processes that are outlined for compounding pharmacies, and people are just buying them, and you get a vial of clear liquid in your house and you're injecting it into your body without any, supervision or control. I don't think that that's the best way to do it.
How has peptides grown for, as an example, over the last 12 years or so? Like, where did it start off at? Like, how did you start hearing about it? And then kind of sounds like now people are kind of going rogue, unfortunately. They're just kind of taking
Right,
medications without, with social media guidance or wherever they're finding that
right,
information, unfortunately.
right, correct. Well, I think you have to understand. So a peptide that's a chemical classification, right? So a peptide is a short string of amino acids but they have to be, put together in the right order in order to get the effect that you want. So peptides are signaling molecules. And so the one that probably everybody knows is insulin. So insulin actually is a peptide chemically, as are most of the signaling molecules, in your body. And so the idea of peptides really started with looking at some pharmaceutical peptides that could be compounded. And back in the day, probably the first one were growth hormone secreting peptides. Because back then, right, I know there are a couple of practices that were very big in hormones and very big in prescribing growth hormone. And I was never keen on prescribing growth hormone itself. And that's what sort of led me to finding these peptides that, you know, uh, encourage your body to make more of your own growth hormone and release more of your own growth hormone. And that's really where that started. And as I got into it, I learned more about different peptides. And I remember meeting a guy at a conference who introduced me to a fellow who had a big peptide compounding pharmacy that they were initially based in Australia, and they opened up here at the time. Interesting enough, and at that time, I had some patients in Dubai and Abu Dhabi, and they just happened to also have a compounding pharmacy in Dubai. And so that helped me to be able to prescribe through the US pharmacy to my patients in Dubai. And that sort of expanded my knowledge of peptides. And obviously that involves a lot of reading and research. And, with peptides, with, a lot of the new things, now longevity is a big buzz, now. And, there are a lot of devices that come along. There's a lot of testing. There's a lot of different things. Everybody wants to know their biological age. And the issue with that is that you still have to have the clinical rigor, right? And there are a lot of companies that are put together with a lot of money trying to build out and scale, and a lot of them exclude a physician, from the decision-making process. And I know that there are people now you can go and buy these big panels of blood, and oftentimes people get them and they may get an AI interpretation, but they don't know what to do with the results. So maybe that was a tangent away from what we're talking about
Well, that's
with pep.
good. It sounds like there's definitely some knowledge gaps in the industry. Just from talking to physicians, it sounds like it's something that's not even in medis medical school today is like a good topic of like functional medicine or precision medicine or integrative medicine. So this is a good topic for our audience and guests to jump into. And then even looking at the industry, you know, where are the blind spots still? It doesn't have to be peptides either. Like in your area of medicine, concierge medicine, where are the blind spots still happening?
Well, I think some of the blind spots are misinterpreting or misunderstanding that, yes, you can get this big blood panel and you may have this abnormal, a couple things are abnormal, but they don't necessarily, first of all, is it clinically significant abnormality? And is that abnormality the thing that needs to be addressed, or do you need to understand the totality of the cellular mechanism and understand why that may be abnormal, and the fix may be in a separate area that is not as easily visible for that? And so, well, let's take law for an example. Right? You know, Anyone can go to a law library. You can read the law for your states or whatever. And if you have to go to court, you can represent yourself, right? Per se. That's a per se process. But if you look at the data, people who do that don't get the same outcomes as when you hire an attorney, because it's more than just reading the letter of the law to practice in law. Same thing in medicine. It's not just, you can be a very smart guy, you can read articles, you can get your blood panel, great. But that does not add up to my almost 40 years of clinical experience
Very, yeah,
applying that information.
yeah, very different. What's like the number one thing that your clients lean on to today as well when they reach out to you? Like, what are you known for in your space? Because you've been practicing for a while. Is there something in particular they like you're really known for?
Yeah, well, so this number of years ago, we looked at the reasons why people came to us. Obviously, we polled them, we asked them, and when we looked at all the individual things, everything boiled down to some diminished performance, whether it was physical performance, sports performance, work performance, sexual performance, and from that, you know, caused us to sort of look at this and say, oh, well, then we need to take that gross performance loss and start to look at the cellular mechanisms as to why that performance is diminished in that. And so that if you then look to optimize the performance of all of your various organ systems as far down to the cellular level as is possible, then you'll perform better as an overall, human being.
And then how do you find yourself adjusting? It might even be daily, to be honest, because it sounds like this field is constantly changing.
Yeah.
How often do you find yourself kind of reassessing things and readjusting?
Well, on a regular basis, certainly over the time that there are things I was taught in medical school as absolute, unchanging dogma that we now know is not correct. So, and that's part of having that clinical rigor and being able to look at things and being open to bringing in new information that will challenge your belief. I'll give an example. Something just recently. There's a young woman who has a strong history of cardiovascular disease in her family, and her lipid profile was not terrible, but was a little bit high, right? But there's something called lipoprotein A, if you're familiar or not. So lipoprotein A is a genetic risk that even if everything else, all of your lipids are fine, that confers significant additional risk. So her lipoprotein A was very high, 3, almost 4 times above the top of the range. So the question is, so what do you do with this relatively, young woman? And she's not my patient. So this is someone I'm just talking to, just generally, they're asking for advice. And they have a cardiologist, and so cardiologist got a calcium score test, which, okay, well, that's great, but that is decades old technology. But I'm not saying it's a useless test, but it's measuring calcified plaque. We now know that the calcified plaque is stable plaque, right? You accumulate soft plaque, and it's the soft plaque that can become inflamed and break off that causes the acute event. So you can have no calcified plaque and still have significant risk from soft plaque. And I suggested to her that, well, ask your cardiologist if they would, send you for a clearly CCTA scan that where you can actually, see that. And the response was, well, we don't need to do any more testing because your calcium score was fine. I'm just going to put you on medication, and you should be okay. And that says to me that that cardiologist is unwilling to at least bring in some more data to say, oh, maybe the way that I believe things should be could be different as opposed to just going along with what the normal course of things are. And that, unfortunately, is in a lot of medicine, because I guess the good analogy is like the big ship, right? To turn a big ship, takes a lot of effort. And if you're in an insurance-based practice, is volume driven, this protocol driven, right? And you do what you do, and it's hard to bring in data, which is one of the things I like about having a relatively small concierge practice where I can really assess new data as it comes in and make the changes as long as the information is sound.
Yeah, and when you're looking at like your current results that you're getting now, what's working really well that you would never want to lose in your practice today?
Well, the thing that is most rewarding about my practice is the relationship that I have with my patients. I've had, I started this concierge practice almost 18 years ago, and my longest standing patient has been with me for almost 17 of the 18 years. She retired and moved out of the country 10 years ago and still flies back, to see me. And I know all of my patients in great detail, and, I think that's a comfort for them. And, an important part of that is at some point, there's going to be a difficult decision that needs to be made. And you want someone who understands your thinking, understands your values, understands, so that you can give them the best advice for them, not the best advice for a population.
Very personalized medicine. It sounds like once you truly get to know someone, especially over 17 plus years, you
Yes.
know them very well. So, and an alternative too, like what's been kind of harder than expected working in this field?
The business aspect of
The
running a
business.
practice,
Yeah.
the marketing aspect of running,
Yeah.
a cash-based practice, that has, been a big learning curve. And I think, the thing that is a challenge now that I'm, working on is just AI, which is going to be part of everything is going to be a big part of medicine, but it has to have its place in medicine. It can't take over medicine. It's not going to take over for doctors, at least hopefully not in my lifetime.
Are there any tools that you've explored in AI specifically? Because I've heard of like tools like Open Evidence, and there's some other ones out there. I'm just curious if you've explored anything.
Yeah, well, yeah. I mean, open evidence is good. The specific tools, I really like Notebook LM. So that really is a great tool. There's one that I think relatively new that I'm looking at that's called Recall.
Recall. Okay.
And Recall, very interesting. So it's held out to essentially be your second AI brain. So instead of, searching the entire internet, you give it information and it just accumulates ideally, all of the information you have in your head. And so, something you may have forgotten, from 5 or 8 years ago when you need it, it is there in the AI when you pose the right question. So that sounds really interesting.
Sounds invaluable. Yeah. Is it a
Yeah.
tool? I'll have to check that out later. I haven't heard of that before. I'm sure
Yeah.
audience
Yeah.
would check it
Yeah.
out as well.
Correct. And Perplexity is another that I use for research.
Yeah, that's a great one as well. And as you kind of work through things, like what's your vision and like where do you want to go like in the next 6 to 12 months?
Oh, 6 to 12 months. Okay. Well, in the next 6 to 12, so right now, again, looking at AI to help increase some efficiency because I want to expand my practice somewhat. I don't know that I would bring in an associate in the next 12 months, but probably over the next 2, maybe 3 years, bring in an associate. Teaching is something that I like to do as well. And so bringing someone in and helping them to learn what I've learned, over the years and have my knowledge, specifically in age management, longevity medicine, will probably be the next step for me. Whether or not I will stop practicing medicine, I don't know if I will ever want to do that because I really enjoy it so much. And again, back to that relationship with my patients, that is the best part of my job. And of course, seeing them make transformations and live better and feel better and all of that. But it is the relationship with my patients, and I'm not sure that I would want to walk away from that anytime soon.
Yeah. Where can people find you, connect with you, learn more if they want to have another conversation?
Well, our website, alternityhealthcare.com, and the office phone number is 860-561-2294.
Well, thank you for your time today. It's amazing to have you, and it was a great discussion. Is there anything else that we maybe didn't cover today that you want to mention, or any other comments?
No, I think we covered, things pretty well. I guess I just wanna reinforce to people who are going out there buying, their lab panels, and there's a battle now, the 100 biomarker panel, the 200 biomarker panel.
Yeah,
You still need a trusted expert to help you make sense of that and to create a plan to have you arrive at a future time. I guess maybe that would be the thing that I have my patients do. It's really important to create a future vision for what you want your health to be, whether it's 10 years, 20 years, down the road. And that's where you need the expert to help you plot a plan so that you arrive, at that future date.
be that guy they're looking for, that expert. Yeah,
Correct.
yeah. Well, thank you, sir, for your time. It was lovely to have you.
All right. Same here, John. All right. Take
Thank
care.
you.